friends, today I'm going to talk about cerebral palsy. This is one of the rare congenital disorder which generally occurs like during the birth or before the birth. Meanwhile, I'll be showing you Margarita with a straw also, in that movie he has portrayed the life of a cerebral palsy patient. So let's watch with me. Well, Margarita with a Straw is a 2014 Indian Bollywood film which was directed by Sonali Bose, and it stars Kalki Cochin as an Indian teenager with cerebral palsy who relocates to America for her study and comes of age following her complex relationship with a blind girl. So, and in the meanwhile, I'll be also talking about cerebral palsy and the details about that disease.
तुम्हें मुझसे प्राइवेसी चाहिए?
Can I have Margarita with a straw?
Listen, would you like me to assign a writer to you? In fact, I've already talked to somebody
Actually, I
being
can
your
type.
writer. I'm sorry, what did you say?
That would be wonderful. Yeah.
Well, cerebral palsy is a disorder which basically occurs either during the birth or before that. It is a disorder that affect muscle tone, movement, and motor skills. That is the ability to move in a coordinated and purposeful way. It is usually caused by brain damage that happens before or during a baby's birth or during the first 3 to 5 years of child's life. The brain damage also can lead to other health tissue including vision, hearing and speech problem and learning disabilities. There is no cure for cerebral palsy, but treatment, therapy, special attention, equipment and in some other cases like surgery can help kids with the condition. Cerebral palsy is one of the most common congenital disorder of the childhood. There are 3 types of cerebral palsy: spastic cerebral palsy, dyskinetic cerebral palsy, ataxic cerebral palsy. Well, in spastic cerebral palsy, it causes stiffness and movement difficulties. In dyskinetic, it leads to involuntary and uncontrolled movements. In ataxic cerebral palsy, it causes a problem with balances and depth perception. Well, because cerebral palsy affects muscle control and coordination, even simple movement like standing still are difficult. Functions that also involve motor skills and muscles such as breathing, bladder and bowel control, eating and talking also may be affected when a child has cerebral palsy. So let us understand how and what causes cerebral palsy. The exact cause of cerebral palsy is not known, but many cases have been found in which the results of problem during the pregnancy when a fetus brain is either damaged or doesn't develop normally. This can be due to infections, maternal health problem, a genetic disorder or something else that interferes with normal brain development. Rarely problems during labor or delivery can cause cerebral palsy. So there are many cases where premature babies have been born, like particularly those who weigh less than 3.3 pounds, that is almost like 1500 grams, like 1.5 kgs, have a higher chance of having cerebral palsy. So premature babies are at high risk of developing cerebral palsy. Cerebral palsy may be diagnosed very early in an infant cause of premature birth or other health problems. Doctors, including development pediatrician and neurological specialists, usually watch kids closely, and they do monitor after birth so that they can identify and address this issue, like if it is developing, or like so that there should be no delay or problems with muscle function that might suggest cerebral palsy. So what problem does cerebral palsy cause? This might cause visual impairment or blindness, hearing loss, food aspiration, the sucking of food or fluid into the lungs, gastrointestinal reflux, that is spitting up. The baby might spit frequently, a speech problem, obviously, drooling, tooth decay, sleep disorder, behavior problems, and there are many other physiological problems as well. Sometimes seizures and speech and communication problems have been found, and intellectual disabilities are more common among kids with cerebral palsy. Many have problems that can require ongoing therapy and assistive devices such as braces or wheelchairs. Well, in terms of treatment, there is no cure for cerebral palsy so far now, but a variety of resources and therapies can provide help and improve the quality of life for kids. Different kinds of therapy can help them achieve for the maximum potential in growth and development. As soon as cerebral palsy is diagnosed, a child can begin therapy for movement and other areas that need help, such as learning, speech, hearing, and social and emotional development. Also, medicine, surgery, or braces can help improve muscle function. For severe muscle pain or stiffness, kids can take medicine by mouth or given through a pump, the baclofen pump implanted under the skin. Thank you friends for watching this video. If you like it, please share with your friends and subscribe our channel Pharmacist and Drugs.